Good morning. This pandemic has highlighted the disparities that exist in our community and in our country. Systemic racism has created two different Americas, one that has access to health care and one that does not. One that can navigate through the challenging times with stable housing and a stable job, and one that provides little stability for anything. Health departments are in place to serve as a safety net for those who do not have access to health care otherwise. That includes those who hold jobs without employer-provided health insurance, the underinsured, and those who have lost jobs or those who are too sick to work. Whatever the reason, the health department is there for everyone. The St. Louis County Department of Public Health has not wavered from its mission. For the past year, it's been leading the response to this pandemic, which has taken the lives of 2,039 St. Louis County residents and infected more than 87,000 others. St. Louis County moved quickly to put in place one of the first safer-at-home orders in the country, and the Department of Public Health worked with our hospitals to closely monitor what was happening in other parts of the country. As a result, we put in place public health protocols that save lives, and we are in a much better place with our decisive, science-based actions. We stood up testing sites across the county, focusing on areas where the need was the greatest. As vaccine became available, we quickly began setting up sites across St. Louis County with our first large-scale vaccination site in Ferguson. We recognize that not everyone can get to one of our sites, so we're putting in place a homebound program to get vaccine to some of our most vulnerable residents. Through the County Office of Emergency Management, the Health Department has begun a critical outreach program. Last week, we ran a homebound program with the Melville Fire District, reaching a handful of residents and their live-in caregivers. This program is only for those limited to their home and not for those who can get out with assistance. We use the definition of homebound from the Center for Medicare and Medicaid Services. We believe that there are several thousand individuals in St. Louis County who meet this definition. At this point, we hope to fully launch the program on March 18th. The county has been collecting referrals from partner agencies for participation in the homebound program, and for more information or to see if you qualify, email dph@stlouisco.com or call 314-615-2660. The county has established a partnership with area universities to set up a screening and scheduling process for this program. Remember, the supply of vaccine is still much smaller than the demand, but it is improving. We are doing our best to reach our most vulnerable residents. And if you have registered on stlcorona.com but still have not been contacted for an appointment, please be patient. We have not forgotten you. And remember, you should also register with local hospital systems and with the state. The state website is covidvaccine.mo.gov. Signing up on multiple sites is fine, and please take an appointment when one is offered. But please do not accept multiple appointments. Doing so could prevent someone else from getting a vaccine. And I'd be glad to answer any questions.
Dr. Page, can you talk a little bit about the UK variant that they found in Water Creek in North County?
The question is about the presence of the UK variant of COVID in our community. And the state issued a press release late yesterday afternoon that hasn't gotten much attention. To note the incidence, almost 25% of the UK variant in our community in the Coldwater Creek watershed, which is primarily North County. We knew that these new variants of COVID would reach our community. They've certainly been in other parts of the country, in other parts of our country. But this is concerning because we know that this variant is more transmissible and that when it is more likely to make folks sick. So we are in a race in our community to get people vaccinated, to continue to follow our social distancing guidelines, when we're out in public, to make sure that we're protecting ourselves and our loved ones, because we have in our community the presence of a more transmissible form of COVID, and we know that it will displace the COVID that we've seen over the past year. Okay, thank you.